Hey guys, this is Dr. Hub. Today we look at the classification of the iron overload. So what does this involve? Firstly, there is a primary hereditary hemochromatosis, primary or the hereditary hemochromatosis. So under this we look at the HFE. There is HFE gene related. The HFE gene related, it includes the type 1, it includes the type 1, and this is C28-2Y mutations, C28-2Y mutations, and this is of genes encoding the genes which encode the HPE. So the genes encoding the HPE. Next, we move on to the non-HFE. The non-HFE, and this is the gene related, and here there is a type 2. So as per the type 2, there is a juvenile hemochromatosis. There is juvenile hemochromatosis. So here there is 2A and 2B. So what is A? A is nothing but the HGB mutation, and that is nothing but the hemotubulin. Then comes the HAMP. So this mutation is nothing but the hepcidin. Next we move on to the type 3. The type 3 is nothing but the transferrin. There is transferrin receptor. So there is transferrin receptor 2, that is the TFR. So this is the TFR2 related. Then comes the 4. The 4 is the ferroportin related HH. Ferroportin related HH. Next is we look at the secondary or the acquired hemochromatosis. The secondary or the acquired hemochromatosis. So what does this include? So here it can include the transfusion iron overload. The transfusion iron overload. So under the transfusion iron overload, this may include the thalassemia minor, this thalassemia major, then the sideroblastic anemia, as well as the chronic hemolytic anemias. Then there can also be presence of the chronic hemolytic anemia. That is what we discussed, as well as the thalassemia major and the sideroblastic anemia. Now we look at the chronic liver disease. So in the chronic liver disease, it includes the alcohol. There is alcohol liver disease. Then comes the non-alcoholic. The non-alcoholic steatohepatitis. So in short, it is known as a NASH. Next, there is a PCT, that is a porphyria cutaneous tarda. Lastly, we are going to look at some other conditions, that is, there can be the congenital transferrinemia. There is a congenital transferrinemia, and as well as there is a African iron overload. There is an African iron overload, and that is known as a Bantu siderosis. It's known as a Bantu siderosis.